Hello everyone, this is your Krishna from Womentoday YouTube channel. So in this channel we have been interviewing many women entrepreneurs and working women across different cities in India. We have been traveling to different cities in India doing offline interviews, and also we are doing online interviews via this Zoom call interview in different parts of India and also across the world. So today's our guest is from Amritsar. So she is a very famous dentist over here, and her name is Dr. Natasha. I welcome you, Dr. Natasha, ma'am, to this Women Today YouTube channel.
Thank you.
So good afternoon, ma'am. So please kindly introduce about yourself to the audience who are watching this interview right now, ma'am.
Hi, I'm Dr. Natasha Saini from Amritsar. I've completed my BDS from Himachal Dental College, and after that, I went on to pursue my master's in hospital administration just to get a little more clarity on clinical operations and patient management. And I also run my channel, Aapki Dentist, on Instagram, YouTube, and Facebook, through which I go on to educate people and make oral health awareness for them. So my focus is to bring preventive dentistry, patient education, and special care dentistry for elderly and differently abled people.
Tell me, ma'am, what point in your life did you decide that you want to make your professional career as a dentist? Like during your school days, you just plan to be a dentist, or is it like someone told you that you can make a good career in the dental side? So tell us about it, ma'am.
I think I didn't choose dentistry. It just happened by chance that according to my marks, I got the seat in dentistry and I started studying. But once I went into it, I discovered that dentistry is a perfect blend of science, art, and human connection. So whenever the people they come in pain and discomfort to the clinic, so a small intervention like a simple filling or a simple scaling, it brings smile on the face. So what I really enjoy the most is to make the people feel comfortable, heard. So this is what is my motivation for every day to get rid the patients of the pain and bring a smile on the face.
Yeah, I do understand that you are doing a very good job. Also, at the same time, consider if any patient is coming to you that they are totally afraid of being coming to a dentist. So at that time, how do
Yeah.
you actually make them cool? Because most of the kids would actually will be very scared of coming and meeting a dentist. So at that time, how do you actually make the patients coming to you to be calm and just go with the procedure that you do, ma'am?
Dental anxiety is real, and not only kids, it is very common with adult patients also. So yes, some patients are really nervous before coming to the dental clinic. So for those kind of patients, we follow a kind of strategy. For example, in the first visit, we usually make them familiarize with the dental settings, the dental tools, equipments that we use, so that the fear is gone. And then after that, in the next sittings, we really like to hear them out what the problem is, and we let them speak, communicate, and so that a trust is built between a dentist and the patient. And after that, slowly and steadily, we start the treatment step by step, and we do not rush. So the patient feels comfortable, and even they feel that we are not rushing. So slowly and steadily, they feel comfortable, and yeah, we do focus on pain-free dentistry. So once they are not feeling the pain, the half of anxiety is really gone.
Yeah, great, ma'am. So also tell us, ma'am. So most of the people should have come to you and visited your dental clinic with the common issue. So what is the common problem that every person have regarding their teeth? Because coming, consider it may be an old age people, a middle aged working person, or something like teenage person or kids. So in each and every category, there must be some kind of common things, like kids may be having this kind of difficulties in their dental things. Elderly people will be having difficulties in this set of things. So what is the common issue that each and every people are facing, and what is the common problem that they come and tell to you, ma'am?
I think the most common dental problem which they come with is the pain and sensitivity, because that is the most common issue. Whenever they come, they usually come with maybe a little swelling, sensitivity or mild, moderate, or maybe severe pain. So then the other step is to find out what the root causes for that pain. Some have caries, some have a problem in the pulp area, some have deep infections, some have gum issues. So then we figure it out that what the problem is, and then accordingly the treatment is delivered.
So what is the common problem? Like what to say? Most of the people coming like with before 20 to 30 years, there was not this much kind of problems. But in the recent 2 decades, like starting from 2000 till 2025, it has been till 25 years. So in this 25 years, what is the common problem for each? I mean, for generally for any category of age people, what is the common problem that they are coming and addressing to you, ma'am?
I think it's caries. The food choices have really changed from past 2 decades. There are so many things out there now, mostly sugary and sticky foods like pizzas, burgers, and candies. Especially the kids, they love these kinds of food. The soft drinks. So they eat all this kind of stuff, but they really do not know how to keep their oral cavity clean. So that is the major issue. So slowly and steadily, the tooth starts decaying, and they do not know it until it hurts. So I think that is the major uh, problem in dentistry right now. That be it children, be it adults, they do not come to the dental clinic until their tooth hurts. They never come for general checkups, because if they do, might maybe we will be able to figure out the minor caries and treat it there and then, and we do not let it advance to the next stage. But till it doesn't hurt, they do not come to the clinic. So that is the major thing.
So you're telling that each and every people should have a general checkup with the dentist near to them. So
Yeah,
tell us
yeah,
that. So for how many months regularly should they come and visit you in 1 year, ma'am?
After every 6 months, it is advisable to visit your dentist. Even if your tooth hurts or it doesn't hurt, you should visit your dentist every 6 months. That is very important. So that even if you have a minor issue in your oral cavity, that can be addressed at the right time so that it doesn't go to the next level. Because when it deepens or it gets severe, more money is involved, more discomfort is involved, and more time is involved in the treat. So it's better to get it checked, regularly.
Okay. So also at the same time, what are the food habits that one should change? Like they should avoid this kind of things in order to not have any kind of problems in their teeth. What are the food items they should completely eliminate from the diet that they're having in their daily life, ma'am?
It's very difficult to say that you should eliminate this thing from your diet. It's not possible. In today's time, it's not possible because kids, they are going to birthday parties, they're going out, right? They're eating all kind of junk, they're eating all kind of sweets, candies, ice creams, they're having cold drinks. You cannot stop them completely, right? But you can avoid it to a certain extent. And whenever you eat those kind of foods, for example, pizzas and sugary items, cold drinks, ice creams, always make sure that after you eat them, you rinse your mouth or you brush your teeth, either of the two. But you need to do that so that the germs and all the plaque that is accumulating, it just you can just control it, right? So it goes both for kids and for adults, right? Whenever you eat any kind of junk food, sweet food, sticky food, to rinse your mouth, to brush your teeth, so that the risk of caries or any kind of decay that minimizes. Also, hydrate yourself nicely. Drink lots of water because that keeps the oral cavity clean. Eats lot of fruits because the fiber in fruits, they keep the teeth and tongue clean. Eat lot of vegetables. Have milk, eggs that is full of calcium and proteins. So that makes your teeth stronger. So these are the simple tips. But if you say you eliminate something, you cannot eliminate anything from your diet. You can just take precautions, and you just need to know how to keep your oral health safe and hygienic. That's it.
Yeah, that's a good answer from you because we can't eliminate it completely. Of course, and practically, if we go to any kind of functions, of course, we should take some kind of food. So basically, it is a combination of everything like colored soft drinks or any kind of Western foods or even Indian spicy foods, something which we can't avoid in our daily life. Okay, ma'am. So also at the same time, other than dental
Yeah.
clinic, do you have any kind of procedures that you go out to a venue and you just educate the people about the oral care? Do you go to any kind of offline sessions, visit any kind of offices or any kind of things, and how do you actually promote yourself and make aware of the oral care to the people outside, ma'am, through online or offline? Do you have any plans promoting yourself, ma'am?
Yeah, first of all, so I told you that I'm running an online channel, Up to Dentist, through which I educate people about all kind of oral health issues. So if you visit my channel, there is a wide range of topics that I've covered. And secondly, offline, we go to different kind of schools in our city. We educate small kids, in fact, kids of all ages. We educate them about the oral health awareness, and we also run free dental checkup camps so that people can come and get themselves assessed and treated.
So you're doing dental camps. So you visit various schools, you visit various industries, various departments, and you do a
Yeah,
free dental camp so that people can come and assess their teeth. And if they have any kind of problems, then they can come and regularly visit you in your clinic or the place that you want. That's what you're trying to tell,
yes.
right, ma'am?
Sometimes we do free dental checkup camps also in our clinic only, so that the people they come, they do not have to worry about the consultation fee. They just come, they get themselves checked, and they get the treatment done.
So, any of your future plans that you're planning to go anywhere and you're going to do anything like you're going to upgrade your service that you're doing right now? So, what is your future aim that you wanted to do in this world regarding your professional career? Is there any kind of new ventures? Is there any kind of new works that you're planning to do in the future so that you can develop yourself in your professional career, ma'am?
Dentistry is all about evolution. Every day a new machine is coming. The dentistry is upgrading itself day by day. So yes, like first of all, we used to take impressions for the teeth to make different kind of oral appliances or maybe dentures. Now the scans have come in, so you just need to scan your teeth and you can send that scan to the lab and the crown is done. So yes, a lot of new things are coming, and it'll keep coming. So you just need to buy them, keep it in your clinic, and you are upgraded. That's it. And we also regularly attend the workshops, webinars, and hands-on sessions so that we can be at pace with the new techniques that are coming into the field of dentistry. So that is what we do.
So I have seen many dentists organizing any kind of group kind of things like they will be having a meeting each and every year. It's like you're from
Yeah,
basically from Amritsar. So most of the
yeah,
seniors and juniors and professional doctors having experience for more than 30 years, they will be organizing a committee and they'll be having discussing a lot of things like that. So
yeah,
how do you actually stay your, I mean, how do you actually keep yourself updated? Like you're going to have a meeting, have a kind of conference with them. I do know that.
yeah.
So yes, tell me.
So the senior doctors and the senior surgeons, they keep on organizing hands-on programs, webinars, and workshops, they conferences. So we keep on attending these from time to time, and through that, we actually absorb the knowledge that they have, and the minor techniques that they tell us to upgrade the dental practice. So that really helps.
Great, ma'am. And also at the same time, most of the people today are coming to teeth whitening. Like most of the people will be want this teeth to be like they want to go and join any kind of beauty show. So at that point of time, they wanted themselves to be appearing more appealing to the judges. So at that point of time, they will be visiting a dentist like you. So what is the procedure mainly you do to the clients who are coming for the kind of teeth whitening and other processes in order to make themselves appealing to the other people? So what are the procedures that you directly do to them, ma'am?
Yeah, if somebody is coming and they want a shade or two lighter, we suggest teeth whitening procedures, but it has to be in office and not at home because because online like Amazon and other platforms, they are also giving you in-home kits and many other these kind of kits that are available at your home, and you can do it at home also, but that is not advisable because it hurts your teeth, right? They can just damage your teeth, they can cause sensitivity. So even if somebody wants to get their teeth lightened a few shades, they have to visit a dentist, a professional who can do it nicely and with the full protocol that is needed to whiten your teeth, that is safe. And for people who are going into beauty pageants, especially the women, if they're going to go in such kind of a platform, then there are other options also, like veneers are very famous these days, and that is a very safe option, and that really enhances your smile also. So veneers is a very good option. But if you're not going for veneers, then yes, tooth whitening procedures are available, but that has to be done through a professional dentist and not at home.
Yeah, I do understand that most of the people should not try privately at the home. So it requires some kind of professional help from you so that they can have the kind of work that they needed to do at the most correct point. So also the said that
Also, there are many DIY options available now on TikTok and Instagram. You mix haldi and turmeric and lemon and baking soda, and then you apply that paste on your teeth. That is not advisable at all because they do more harm than good. They will spoil your teeth. The upper layer of the tooth, that is the enamel, they make it erode, and then the sensitivity happens. So a big no to the DIY treatments. Kindly visit your dentist for all the concerns you have. So that is the best thing that you can do.
and also, I heard a lot of treatments mainly going on for root canals. So tell us what one should do if they have this kind of root canal treatments. Is it really necessary, or is it something like which we can just skip? Tell us about the root canal treatments and what actually makes us to actually go through this root canal treatments, ma'am.
Basically, see what happens is when a tooth get a cavity, right? So if it at the initial stage, then it gets treated by the filling, a normal filling, right? But yes, if you delay it, you do not get it filled. So over time, that deepens, the infection deepens, and it reaches your nerves that are inside your tooth, right? So when the infection it reaches your nerves, then the pain and sensitivity starts. So at that point, there is no other option than a root canal. Because what is root canal basically? We open the tooth and we extract all the damaged nerves from the tooth. So basically, we are pulling out the nerves that have been damaged by the cavity or the decay, right? And then we clean the canals and then we fill it with a permanent kind of filling. So the pain is completely gone. Basically, you are making the tooth dead so that it doesn't pain and it does not feel any kind of sensitivity. So when the caries reach that level where it causes so much of discomfort, pain, and sensitivity, the root canal is the only treatment that can really help you. Otherwise, if you do not want a root canal, then you can go for an extraction. But it is always better to have your tooth saved and not extracted because extraction is not the solution, right? So it's always better if you can save your tooth, you should save your tooth. And root canal is a good option to save your tooth.
Also, at the same time, is there any kind of disadvantages in doing root canal? Like, is there any kind of side effects, or is it like completely safe? Because most of the treatments, what we see while we go to a dental clinic is that these kind of root canal treatments. So, is it having any kind of side effects, or is it totally safe? That what you want to tell to the patients regarding this root canal once the treatment is getting over, ma'am?
Root canal is totally safe. There is nothing to worry. But yes, if you are going for a root canal, then after that, you must go for a dental crown. That is very important because after the root canal is done, the tooth becomes dead. It is basically a dead tooth that is in your oral cavity and that will perform all the functions like chewing and everything, right? But over time, this dead tooth becomes brittle in nature, right? So if you do not get a dental crown on the RCT treated tooth, then it is possible that whenever you are having your food, maybe a sticky food or hard food, your tooth might break down. So that is even worse because then it is very difficult to extract the root canal treated tooth because it's another chapter then, right? So it is always advisable that if you are going for a root canal treatment, then you should get a dental crown on that because it makes it stronger and the life of the tooth increases. After that, you eat anything, you don't have to worry that okay, my tooth will break. So a dental crown is must for all those people who are going for an RCT. You should not skip a dental crown over that.
So, for how many days should we wait once the root canal treatment is over to get this dental crown in the teeth, ma'am?
It is a simultaneous procedure. Like if when your root canal is completed after giving the final filling, the tooth is a tooth is reduced into a smaller size. An impression is taken, and in 2 to 3 days, the lab will give you the dental crown. So it is a matter of 2 3 days only. It is not a very long procedure.
That's a great thing. And also at the same time, what advice would you like to tell the people who want to avoid this kind of root canal treatments, ma'am?
Keep your teeth clean, right? So you have to brush 2 times a day. Try to brush 2 times a day. Flossing is really important, right?
What's actually
Because
flossing, ma'am?
80%. Uh, can you see?
Yeah, yeah, that's a floss, ma'am.
Yeah. So this is a floss. It is a Colgate floss,
Okay.
right? Easily available in the and see it's a kind of thread,
Oh, great.
and you just break this thread
And you can
whatever
just,
length you want.
yeah, now I understand. Yeah, people do this, but I'm not sure that where it is available, but you're having it. Yeah, I do understand.
Yeah. So you have to just put it in your teeth
In
and you have
between
to
the
pull
teeth
down
and
all the stuck food, right?
yeah,
Because 80% of the food it is stuck between your teeth. Whenever you are brushing, you are cleaning the outer surface of the teeth or inner surface of the teeth, right? But the food that is stuck between the spaces, only this floss can help you bring that out. So flossing is really important. Try to practice this once a day, right? Always clean your tongue because people tend to clean their uh, tend to clean their teeth, but they always forget to clean the tongue. They think that it's not important, but it's very important because major debris of the food and bacteria they grow on your tongue, right? So it is very important to clean your tongue, clean it from inside and out. You can use soft bristle brush if you want. You can use a tooth scraper, a tongue scraper also, and that really helps. Avoid sugary and sticky foods. Eat lots of fruits, vegetables. Hydrate yourself. So if you follow these basic guidelines, you will end up having a good oral hygiene. You will be able to avoid the cavities and hence the dental treatments.
yeah, that's a great thing because also at the same time you have done a very good thing. Like you have said us that okay, while we are just using the floss, that what happens to the gum which is present in between our teeth? Does using floss affect the gums? or is it totally safe, ma'am?
First of all, the gum is not present between the teeth. It holds your teeth from upside, right? So the two teeth are joined like this. So between these teeth, there is no gum, right? So when you are using a floss, you are cleaning the inside space of these teeth. Yes, the flossing technique is very important. You have to be very gentle while you floss so that you do not injure your gums, right? If you floss really hard and your technique is really hard, you might end up injuring your gums. So first, you have to. There are many YouTube videos available how to floss. You can just go and watch them how to floss, and then you have to start very gently, and you have to clean all the surfaces, keeping in mind that you do not injure your gums.
Okay.
And some people who are really afraid of these thread floss, they can also use water flossers. They are available now in the market, right? So it is a completely safe option and it is a very advanced option. It's a kind of unit, and a small bottle is given with that. You have to fill it with water, and you have to whenever you start the button, there is a nozzle from which a water spray comes out, right? So you can adjust the speed according to your comfort, and you have to focus that water spray on the tooth surfaces and wherever you feel that your food gets stuck, so that water really flushes out the stuck food and debris from your teeth. So even that is a very good option. If you are scared of this thread floss, you can use a water flosser, which is very easily available now in the market, and online also it is available. You can order that, you can use that.
Great, ma'am. So, what type of food we should try to avoid? As you told that, should we avoid any kind of non-veg foods? Like most of the people are getting some kind of meat which is stuck in between their mouth, and in a series of days, like around 10-20 days, they are not aware of the kind of things which is stuck in the teeth, and it caused a lot of problems. So, what are the major food items that one can actually eliminate? What one can actually try to eliminate from the diet chart that they have in a daily life?
Again, as I said, it is very difficult to eliminate anything from your diet because the non-veg lovers, right, be it seafood lovers or meat eaters or chicken lovers, they will not stop eating all these kind of foods. Yes, it is flesh. Whenever you eat, it will get stuck in your teeth. And as I said, that after eating your food, be it chicken, meat, fish, or any kind of food that gets stuck in your teeth, you really have to see that rinse your mouth, floss your teeth, or even better, you brush your teeth, right? You do that, everything gets stuck, it will come out. So enjoy your food. Dentistry is not about stopping you from eating anything. It's not about that. We say eat everything that you enjoy. If you enjoy sugar, you have a sweet tooth, enjoy sugar, having candies, having desserts, you are a meat lover, whatever you want to eat, even the simple home cooked food, right? Anything you eat, if you do not clean your teeth properly, it will cause caries. It is not that a particular kind of food that will cause caries. No. Even a simple home cooked food you eat and you do not clean your teeth properly, it will also cause caries. So, do not eliminate anything from your diet. Yes, avoid sugary foods, avoid acidic foods, avoid sticky foods if you can. It is always good. Prevention is better than cure. Of course, we all know, right? But even if you are not able to do that, whenever you eat such kind of things, just do a quick brush, do a quick rinse, or floss your teeth, and then you're good to go.
That's a
Right?
great, yeah, that's a great kind of advice, because most of the people will be telling like avoid these kind of foods, avoid those kind of foods. But you're being a dentist and you're just encouraging every people to have whatever the food they want to have, and you're there to help them. So no need to worry about that. So okay, ma'am. So we have discussed a lot about the kind of process that the patients involve, and also the kind of process as a dentist which you involve. So tell us, ma'am. You told me that instead of avoiding many kind of foods, we can just follow small dental procedures like brushing our teeth, flossing the teeth, and also you just demonstrated what is actually mean by flossing by showing the kit which you have in you. So that's actually a good thing. So people who do not know about flossing, in this video they'll be able to know about it. And you also told us that you should brush your teeth regularly, twice a day. The thing is that most of the people are having a lot of confusions in what type of brush should they buy in the market, because when you go to the supermarket, in the rack you'll be seeing a lot of different kind of brushes starting from rupees 10 to rupees 500. So that's how massive the toothbrushes are. Even now we are having automatic toothbrushes which we should keep in front of our teeth. It will do everything, so no need to worry about anything. So we are having normal brushes to even more expensive brushes with automatic kind of things. So tell us what kind of brush we should actually choose. Or is it like we can go for olden age kind of methods where they used to just pick a neem stick from the tree and they'll just brush the teeth. So it's like a good thing, organic thing which they get from the mother nature, that most of the ingredients which is present in the neem tree, when it is cut and when we just have it in our teeth, we're just brushing in our teeth, we'll be just getting rid of all kind of negative things. Taste will be too much bitterness available in that neem. So tell us, what do you actually prefer? If you want to select a brush, what type of brush should we select? And should we go for a neem kind of sticks as the olden age method? Or tell us all about it, what you can advise us, ma'am.
So you see, in the ancient times, people used to use that neem sticks to clean their brush. Basically, neem is antibacterial and anti-inflammatory in nature, right? So whenever they used to cut the sticks, they used to chew it, and after chewing the fibers that come out of the stick, they used to use that fibers as the natural toothbrush and they used to clean the teeth. So that is completely harmless. Many of the people now also in the rural areas they're doing that. It is not harmful. You can do it, right? But a manual brush is always preferred over a neem stick because it has good nylon brushes, bristles, which clean the teeth more efficiently, right? So now the thing that is important is that your toothbrush, if you're using manual toothbrush, so the bristles they have to be really soft in nature, right? They should not be hard because many toothbrushes they have hard bristles. Even if you go to a hotel or on a vacation, the toothbrush that you get in your dental kit, you might have noticed it has very hard bristles. So hard bristles are not advisable for your teeth because they wear off the top layer of your teeth, that is the enamel, and then that cause sensitivity, that cause erosion, and then eventually to sensitivity. So always use the soft bristle toothbrush which are readily available in the market. Whenever you go for a shopping, you have to read the label. It is soft bristle or ultra soft bristle brush. It's always written. They come in Colgate, they come in Sensodyne, they come in Oral B, right? But it is written soft bristles or ultra soft bristles. So you read them and you buy them, right? And if you are a lover of electric toothbrushes that are also available in the market, they are a little expensive, but yes, they are automated brushes, okay, and they have different levels of speeds, different kind of rotations. You set them according to your need, and you just have to place it in your mouth on the tooth surface, and that will do the cleaning. So even that is very effective. It is more effective than the manual toothbrush. But for some reason, if it's not affordable by you, you can use a manual toothbrush also. That's equally good. You just need to know the right technique to brush your teeth because many people they are brushing their teeth, but the technique that they are following is not right. So the technique should be right. That is important.
What is the technique actually that you are mentioning right now, ma'am?
For that, I'll be needing, I think, a tooth model. I can show you that. Just wait. So yes, this is a tooth model that we have. And I think this will give a better understanding how to brush your teeth nicely. So this is a toothbrush. So you always have to start from one side. right? You don't have to start from middle. Start from one side and keep your brush at a little 45-degree angle, right? And then you have to move the brush in gentle circular motions up and round, right? And from starting from one side, complete the all the side and move to the other end in gentle circular and up and down motions. Most people, what they do is they brush the teeth like this horizontally. I don't know how do you brush, but you tend to do this horizontal movement. We think that this cleans the teeth better, but this is a wrong technique. Horizontal movement of the brush for cleaning the for cleaning the teeth is not advisable at all, right? It causes cervical abrasions. Many people must have noticed कि उनके gums के नीचे जो दांत है यहाँ पर cuts पड़ जाते हैं. So that is because you brush your teeth horizontally. So they remove the top layer and they cause cuts on your teeth. So eventually that cuts they lead to pain and sensitivity because your roots they get exposed. So that technique is very important. Then when you open your mouth, this is your upper teeth inside area, right? So you have to brush, you have to hold your brush vertically and you have to brush from inside and out. This is the surface जहां से आप अपना खाना चबाते हैं. यहाँ पर आप सिंपली हॉरिजॉन्टली ब्रश कर सकते हैं. बट क्लीनिंग ऑफ दिस एरिया इज वेरी इंपॉर्टेंट बिकॉज यहाँ पर सारा मेजर फूड आपका स्टक होता है. कमिंग टू द लोअर आर्क, दिस इज योर front teeth, lower front teeth, the inside area where the tongue is placed. So you have to hold your brush vertically and inside and out. So you have to push the food and debris outside, right? And this is again the chewing surface of the teeth. So you have to clean it like this. So this is the right technique to brush your teeth. You do not have to brush your teeth horizontally. Just keep in mind, no horizontal brushing. Always gentle circular motions starting from one point and traveling to the another side. Your brush should be really soft. And always remember, brush for just 2 to 3 minutes, not for 5 minutes, not for 10 minutes. Because brushing for longer period will not clean your teeth better. You are just eroding the upper layer only. So 2 to 3 minutes of brushing is enough, right? So if you cannot keep track of the time using a manual brush, that is what electric toothbrush can really help you in, because the timer is set. In the electric toothbrush, you just have to on the brush, you have to clean your oral cavity, and in 2 to 3 minutes, that will completely clean your teeth. That's it.
Yeah, that's a great thing which expected from you, ma'am, because we have just discussed a lot of things. In the first part of the interview, we were just talking about what kind of foods we should eliminate, what is about a root canal treatment, tell us about whitening of teeth. But the very first day of our life, not only what to say, the very first part in our life, the very first duty which we do once we get up from our bed is brushing. That's the very first thing which we
Yeah.
do. Yeah, as you said, most of the people will be just brushing the teeth horizontally because we do not have any kind of proper people like you coming and advising us that's the right way. So we should keep the brush towards at one side in 45-degree angle, and we should not do just like horizontal brushing. We should just rotate from one side to the other side in a 45 degrees angle. And when we are cleaning the upper part, we should keep the brush in the vertical way, and we should keep it in a way that it comes like in a vertical way. And also when in the down in the lower jaw, we should keep it vertically, and we should just clean it so that the food particles which is coming in front of, I mean, in our mouth will be eliminated out. And the very important thing is you should brush your teeth 2 to 3 minutes a day. That I think most of the people
Yeah.
just forget to say actually,
Yeah.
because people actually think that okay, we are just going to apply the paste and we are just going to brush
Yeah,
our
we
teeth.
have time. keep on brushing, let's do it nicely, अच्छे से साफ हो जाएगा. But it's not like that. You are actually harming your teeth, right? So 2 to 3 minutes of brushing is more than enough. That's it.
Yeah, 2 to 3 minutes of brushing is more than enough. And also, people think that if you put paste and if there is a lot of foam coming out, then we are just doing a great kind
Yeah.
of good brushing.
But that is also a thing, that amount of toothpaste is also very important. Usually what people do is that they push the toothpaste along the whole set of bristles, you know, a long line of toothpaste.
Long
That is
line,
not advisable.
long line
Only,
from
yeah,
the
long
end to
line
the
until
long.
your full toothbrush gets covered with the toothpaste. They will apply it, but it's not. That much of toothpaste can actually clean three people's teeth, right? So the actual amount that you should apply on your toothbrush is just a pea size, एक मटर का दाना. That's it. उतना ही ब्रश आपको उतना ही टूथपेस्ट आपको आपके ब्रश पर अप्लाई करना है और आपको ब्रश करना है. दैट इज मोर देन इनफ. You do not need to cover your toothbrush fully with the toothpaste. No. That way you are anyways just wasting the toothpaste. It's not going to do any good for your teeth.
That's a great thing, ma'am. So tell us, ma'am, you have just advised us to choose the kind of brushes before just buying a brush from a supermarket or any store near you. You should check the bristles that you have. If that bristles in the pack is mentioned as soft bristles, then we can go and buy it. If it is mentioned as hard bristles, then we should try to avoid it. So tell us, ma'am.
It's
Also,
never mentioned actually for hard brushes. It's never mentioned it is hard bristles. It is not mentioned. But for soft and ultra soft, it is mentioned on the label. You
okay.
need to read that.
Great. So that's a great kind of good thing information which we got from you. We can just read the soft bristle and ultra soft bristle, something like that. So tell us, ma'am, you have just advised us to choose the right kind of brush and also the right technique to brush. So tell us again, what type of toothpaste can we use? Because in the market, there are a lot of varieties which is tagged in the supermarket. They're starting from the charcoal kind of toothpaste, from red color gel toothpaste, white color normal toothpaste. There are a lot of varieties which is existing right now. We just getting kind of max fresh gel, normal toothpaste, charcoal one, flavorful one, green color, blue color. What to say? There are lots of things existing over there. So what kind of paste do you actually like to advise to the people so that they can choose the right paste? You can just tell the ingredients that which you wanted to tell to the people, ma'am.
See, when you go to a supermarket, a whole lot of varieties available, and especially the non-branded like Dant Kanti and Dabur Red and Patanjali toothpaste. They are not advisable at all because they contain high amount of abrasives in them. People not aware about are not very aware about it, and they start using it. Especially the charcoal toothpaste that got a lot of popularity back then. It is also not advisable now because the charcoal is highly abrasive in nature, and when you start using it, it kind of abrades the top layer of your tooth. So you should avoid using Dantkanti, Dabur Red, Patanjali. In fact, there are powders available. Toothpaste powders are available that you have to put on your toothbrush and you have to brush. Even that is not advisable because that also contains high amount of abrasives. Also, teeth whitening toothpastes are really popular among people. They feel that we use them and at home only we'll get 1 to 2 shades lighter. That is not advisable at all because again that contain abrasives that removes the top layer of your teeth. They might give you a little light shade over a period of time, maybe 1 month, 2 months, or 3 months. You might get a shade lighter, but over a period of time, you will develop sensitivity and eventually pain. So that is not advisable. The toothpaste that are advisable are the good company ones like Colgate, Oral-B, and those kind of toothpaste. They are advisable. Colgate has launched a number of toothpastes catering to different needs of the people. So you need to see that what kind of problem you really have, and accordingly you can just choose the toothpaste, right? And also I would like to mention is that the people who have small kids, like the kids who are smaller than 2 years, who do not know how to spit, right? For them, special toothpastes come that are without fluoride, so that because they do not know how to spit, so that they do not because उनको spit करना नहीं आता है, तो कई बार क्या होता है कि they take the paste inside, they swallow it. So if your baby's toothpaste, they are containing fluorides and they are ingesting it, it is not good for their health. So for them, you need to you need to read the labels that it is no fluoride. Once your kid learns how to spit out while brushing, you can give them the fluoride toothpaste, and that also for children, special toothpaste till the age of 6 they come. For them, it's different toothpastes in which fluoride is present but in little smaller amount, right? For them, that is okay. And after 6 years, when they are fully aware and they fully learn how to spit while they brush, they can use the normal toothpaste that is available at home. But for children less than 6 years of age, you have to see as parents that if your baby or kid, he or she knows how to spit, then only give them fluoride toothpaste. Otherwise, give them no fluoride toothpaste so that they doesn't harm the system, right? And for adults also, you have to use fluoride toothpaste so that your teeth they remain stronger and free of cavities. So these things you have really have to keep in mind. And for people who really have sensitivity in your teeth, it is better to consult a doctor. They will advise you what kind of sensitivity you have, what kind of dental problem you have, and then according to your situation, according to your oral need, they will suggest you a toothpaste which is more advisable to buy from the market than go on and experimenting at your level. That is not advised.
That's a very great elaborate answer from you regarding what type of toothpaste we should select. Actually, you have mentioned that kids can go with less fluoride kind of things so that they'll be able to just swallow them. Even if they swallow them, then there's no any kind of problem in them. That's a great thing from you, ma'am. So just tell us, ma'am. So you have told a lot of details that the correct brush we should choose, the correct way of brushing, and also the kind of toothpaste we can use. So now again coming to tooth powders. So most of the people will be advising us like ancient peoples, not ancient peoples, people from the 1990s, 1980s. So during that era, people will be using a lot of tooth powders. Actually, it's kind of organic powders. But the problem is that nowadays organic powders are not too much genuine, which we are afraid to trust them because people nowadays the in the market toothpaste are just dominating each and every tooth powder. So all over the world, toothpaste is dominating. Only in India, people do choose to use tooth powders even right now. So tell us, what is the right tooth powder? Is there any kind of organic right tooth powder which we can trust and which we can genuinely buy them so that it will do good for us? Or is it like, okay, if we use tooth powders, then it will cause these kind of side effects in the future. So better to avoid tooth powders and better to choose the toothpaste. So tell us what are the things you wanted to tell about the tooth powders. They want to use it or they don't want to use it, ma'am?
I think as a dentist, I don't recommend the use of tooth powders because you really don't know what the ingredients are actually and how much fluoride content is there, how much abrasives are there. So it is always a safe option to use a certified toothpaste than over the tooth powders. I really don't recommend the use of tooth powders for cleaning your teeth.
Yeah, I
Not
do.
advisable.
Yeah, I do understand. So we have started from the right brush, right kind of everything we have discussed, and most of the people are worried about sensitivity because people we see in advertisements, they just people will be coming and they'll be biting the ice cream, that it's not ice cream, the ice, and they'll be feeling a lot of sensitivity in the tooth. So what is the problem which causes sensitivity? Can we avoid sensitivity? Like, most of the people are not having sensitivity, but is it like what are the things which lead us to go into sensitivity? Most of the people will advise us not to eat ice creams, not to eat ice sticks, mainly ice bars, I think that's the right word, not to eat ice bars, so that we'll be having a lot of tooth problems. So is it really that if we eat ice cream, we'll be having a lot of tooth problems? Or what is the main cause which leads to sensitivity in the teeth, ma'am?
See, again, sensitivity is a very common issue, and sensitivity is not only because you eat ice creams. There are a lot of reasons why are you getting sensitive teeth. Sometimes, as I told you, some people they really use hard bristle brush. So over time, the enamel that gets eroded and sensitivity starts. Right? For some people, it may be caries. Right? For that has deepened and reached the pulp area, and that is causing pain and sensitivity. For some people, it is a cervical abrasions just below the gums because the brushing technique was not right over the years. So they have caused the cuts in the teeth, and that causes sensitivity. So for every person, the reason is different. It is not the same reason for every person, right? But yes, whenever you will eat or drink cold things like ice creams or maybe colas and soft drinks, you might feel uncomfortable. So ice cream is not the only reason, but you need to visit the dentist. They will do a deep scanning of your oral cavity. They will find the root cause. Why are you feeling the sensitivity? What is the major root cause? Is it caries? Is it the is it the tooth abrasion? And accordingly, the treatment is planned. Sometimes the use of sensitivity toothpastes that can alone help. You do not need to do any other thing. And sometimes the intervention is needed, the treatment is needed, like fillings, like root canal treatments, and that helps. So, for every patient, the reason is different, and for every patient, the treatment is different. It depends what your problem is.
I do understand that it's not only single cause, but there are a lot of causes which leads to sensitivity.
Uh,
Okay,
yes,
okay, ma'am.
yes.
Okay, so on the other hand, you are being a successful dentist right now. So, what advice would you like to tell to your juniors who wish to be a successful dentist like you? So, there are a lot of upgradations in the kind of education that we go through in the dental industry. So, right from high school, how they can prepare themselves to enter into this medical industry, mainly in the dental area, and how one can upgrade themselves. What are the things they should learn in order to become a successful dentist, and what are the things that you would like to tell them to become successful in this career, ma'am?
See, dentistry is both science and arts. So, if you are a lover of science and you're a lover of art, you'll really enjoy your field. And keep upgrading yourself, keep learning, never stop learning, because every day a new thing is coming up in the field of dentistry, be it machines, be it techniques, be it treatments. So there is a lot of evolution in this field. You have to really keep up your clinical skills. That is really important. And do not forget to upgrade your soft skills also, like empathy, communication, and leadership. Whether you open your clinic, work in a hospital setting, or you go on for like becoming an oral educator like me, have to keep in mind that you are committed to excellence and ethics. That is really important being a doctor. Always remember that kind smile can do wonders. When you communicate to your patient nicely, you listen to them patiently, half of the anxiety and half of the problem is gone there and then. You have to ensure that a trust is built between you and your patient, and that is only possible when you communicate with them, listen to them properly, so that they feel comfortable and they tell you your problem nicely and the solution is carved out.
Yeah, one thing I can understand is dentist is a kind of field which involves both medicine and the artwork. Yeah, that's really a great kind of answer from you. Because I thought that okay, being if you're going to be a dentist, you should prepare a lot of things. You should start sacrificing a lot of things since you have to concentrate on your studies, and you should spend most of your time without watching any kind of other online entertainments or offline kind of activities. I think that's the answer you're going to tell. But you have, in the very first part, you have told the right thing, that dentist is something, a professional career which involves both scientific medicine and also art, because you're just working with people's teeth, you're just carving them, making it in the perfect way. Of course, I have seen most of the dentists grooming many beauty pageants and making their teeth in the correct way, that it should be very appealing to the judges and also to the audiences. So you're doing a wonderful service right now, ma'am. And tell us, ma'am. So if you told us every 6 months that one should come and visit a dentist. So what happens if one do not come and visit a dentist, and if they do not have any kind of general checkup once in 6 months? Because most of the people, they'll be only coming to dentists or they'll be coming to doctors only after if they have a problem. So before that, nobody will come and visit a dentist. Of course, if we have a friend and if he is a dentist, if any member in our family, or if any member of a known one, then we can just go regularly meet them, kind of have kind of fun activities with them. We can just ask them, okay, please check my teeth, is there any kind of problem? We can just ask to them. Other than that, most of the people will not be having time, and they'll not be considered and to go and have a general checkup with the dentist over there. So what kind of message would you like to tell to them, so that they will be able to come and get a general checkup, and they can help them save from the tooth and dental troubles in their early life before going on to the ultimate level, ma'am?
See, as a dentist, my message is to all the people is that life is very busy and all of us are very busy. But if we can take time out for other things like eating food and having bath and doing meetings, meeting our friends, watching TV, going to restaurants, everything is going in your life, then it is your priority to keep your health, be it your general health, be it your oral health, up to mark. You have to take the time out. This is no excuse that we are busy and we cannot come to the clinic. No, right? Because it is your life, it is your health, and your oral cavity is the gateway to your general health. Once it is not clean, once it is not healthy, how can you expect your general health to be okay? So studies have shown that your oral health do affects your heart health, it do affects your hormones, it do affects the body of a woman in many ways. It do affects your immune system, it do affects your gut health. So this is a gateway to a healthy body.
Yeah.
So whenever you get time, you must go to a dentist. It will hardly take an hour. So if you can take time out for other things in your life, you can also take time to visit a dentist. It is not a big deal. You do not have to travel abroad for this. Okay? Many dentists are available in your nearby locality. It is just you have to take an initiative. People are taking initiative. They are just laid back. It is dentistry basically, the oral health basically, the people have taken a back seat. Okay, I'm fine. I do not feel any pain. Everything is okay. Let's not go. Right? But sometimes even you do not know that a small cavity or caries have already started in your teeth, which you maybe cannot see or maybe you cannot feel. But it is there, and only a dentist can see that. So prioritize your health, and if you prioritize your health, you will have a healthy body, healthy mind, and you can work wonders in your life.
That's a great thing because I have seen this one particular sentence I have read in the internet, or I have been knowing in any kind of videos, that each and every teeth is related to your physical health. If one teeth is having any kind of problems, then it will lead to a lot of severe issues in your body. So better take care of your teeth, because I have seen videos like, okay, if any one tooth is removed from your mouth, then it will lead to some kind of problems in your kidneys or liver or heart or brain. So each and every teeth, each and every nose, actually the thing is that the very strange fact is the whole physical body health is dependent only on based on your teeth. This 100%
Yes,
most of the people don't know. Am I right, ma'am?
yes. As I told you, that it is the gateway to your whole body. So it needs to be clean,
Yeah,
right?
yeah.
Because everything you are eating is from your mouth that is going inside. If you have germs, if you have lot of bacteria accumulation, you have pus, you have infection in your mouth. While you're eating food, that infection, that pus, that germs, that bacteria, they're anyways entering into your body system. They are entering your bloodstream and they are affecting you in number of ways. Even you don't know that. So this is the area that needs to be really focused on.
Yeah, also at the same time, being a dentist in Amritsar, you're concentrating in Amritsar. So, what's your? Please tell us your dental clinic name. So, if a patient wants to come and meet you, if any member wants to have a general checkup with you, so which address they can come and meet you in Amritsar? Please tell us about it, ma'am.
So right now I'm working with my friend. So we both are running our clinic. Basically, I'm working for her, right? And our clinic name is Peridot Dental Studio. It's located in New Amritsar, 40B, New Amritsar, and it is readily available on Google. You can search us, and you can visit whenever you want. We are here till 11 to 7 p.m.
Any working holidays, working time?
We work from Monday to Saturday, that is 11 to 7 p.m. And Sunday is an off. But if there is an emergency case or maybe a surgery planned, then we can work on Sundays too. But that is only on appointment basis.
I do understand, ma'am. So, people who are watching this interview right now, please do subscribe to our channel. We are just doing online and offline interviews across different cities in India and also across the world. So, thank you, Dr. Natasha, ma'am, for letting me to host you in this interview. You have done a very wonderful
Thank you.
job. You have told a lot of things about the kind of dental health that we should have in our life, and people who wants to have some kind of talk related dental issues can approach Dr. Natasha, ma'am. She is very well available in Aapki Dentist Instagram link. Of course, she has a separate Instagram page. Her name is Aapki Dentist. She is in Amritsar. You can, I'll just text you the Instagram link in the YouTube description down here, so that you can click the link and have a direct conversation with Dr. Natasha Saini, ma'am. She is in Amritsar. It's not about people who are only in Amritsar. They can contact Natasha Saini, ma'am. I just want to let you know that people, you may be in any part of India, or you may be in any country in the world. If you want to have any kind of things which you need to checked upon related to dental issues, maybe it may be for you, it may be for your friend, it may be for your kid, it may be for old age people in your home or anyone. You can just have an online conversation is very much available by just texting the Instagram link, Instagram, visiting the Instagram page of Dr. Natasha Saini, ma'am. Once again, I'll mention that is Aapki Dentist, so you can directly have a conversation with her. And if you do visit Amritsar, or if you do have time, you can directly visit her clinic, which she had already mentioned over here. So that was a really nice conversation with you, Dr. Natasha, ma'am.
Thank you for having me.
This is your Krishna signing off, and today's our guest is Dr. Natasha Saini, ma'am, from Amritsar, ma'am. So thank you once again for everything. Good evening. Have a nice day, ma'am.
Thank you. Bye bye.
Yeah, bye, ma'am.